What would you say to a young person who came to your clinic, maybe with their mum and dad, who said to you, "Doc, what about these thyroid function tests? What do these? What is it you're actually measuring when you take my blood sample?" What would you say to them?
Yeah, so often this is the first sort of introduction to thyroid function tests that they've had, isn't it? They come from the GP referred with these tests, and I try and break it down into the TSH, so the thyroid stimulating hormone, which is produced in the brain, and that tells the thyroid to function. And then you've got your free T4 levels, which are the most commonly measured in GP land. And I tend to sort of say, if your TSH is high, it's the analogy that I think you first used about the horse and the jockey, and it's a bit like the jockey having to whip the horse really hard. So the TSH is having to work really hard to produce that thyroxine, whereas if your TSH is low, the horse is galloping away and you're not having to whip that horse at all. So it tends to be those are the two patterns that we see, don't we? We either see the TSH being high and the thyroid hormones themselves are low, or the TSH is low or suppressed, as we often call it, and the free T4 level is too high. That's really what we normally see, isn't it?
So using my wonderful horse and jockey analogy, if you're underactive, then the jockey's whipping the horse like mad, but the horse is going slowly. And if the young person has an overactive thyroid gland, the horse is galloping and the jockey's sat there doing nothing. So the TSH level would be low. Whereas in the first scenario, when the jockey is whipping the horse, in the context of hypothyroidism, you'll have a high TSH and a low free T4. Right. Okay.
So, and those are the most common thyroid function tests that we see, aren't they? I mean, very occasionally, you can get a sort of a slightly different picture, can't you? Where the TSH, because the problem is from the brain, so secondary hypothyroidism, then you don't get that jockey able to whip the horse, so the TSH stays low even though the free T4 is low. But that's much rarer, isn't it?
Yeah. So if I was to, I'm into this analogy in a big way, as you probably noticed, Claire. So just to recap for people listening in, then if you're hypothyroid, the TSH is high, free T4 is low, so the jockey is whipping, but the horse isn't moving. In the context of overactivity, typically that's the TSH low, thyroid hormone levels high, that's the jockey sat there doing nothing, but the horse is galloping.
Yeah. And
then the final scenario that you talked about was the secondary hypothyroidism, which is where you have a lowish TSH because the pituitary gland isn't working in the normal way, and a low T4. And going back to horse and jockey, that's a jockey sat there on a horse, neither of which are doing a great deal.
Yeah, absolutely.
There's another question here, which is about free T3 or T3, and it says, why is T3 not routinely checked?
I mean, we do check it in some instances, don't we? We tend to check it, don't we, if the thyroid's overactive, because it can be a useful marker then, but we very rarely, it's not a useful signal for us if it's an underactive thyroid that somebody has. We tend to just rely on the free T4 at that point, don't we?
I think I totally agree with you. I think the T3 in the context of thyroid gland overactivity is very, very handy, very, very useful. It tells you important information. I suppose the problem with T3 in people who are underactive is that it doesn't really give you a proper insight into the status of the thyroid gland. And my analogy was thinking about going past a shop window, let's say for the sake of argument, the baker's shop window. In some respects, what you want to know is how good the bakery is. You want to know whether the bakery is thriving, and you look in the shop window and sometimes there are lots and lots of cakes there, and whilst you might come to the impression that everything is fine, it's not really measuring what's going on behind the scenes, and everybody could have pulled the stops out and produced this great show in the window, but in reality things behind the scenes might not be all well. And it's a bit like that, isn't it, in people who are underactive. It's almost as if the thyroid gland pulls all the stops out and you see sometimes a normal T3, when in reality the thyroid gland is struggling and is not in the best health at all. So you can think, oh, everything's fine when it isn't. But it also works around the other way as well. Continuing with the same analogy, you can go along and the shop can be empty, but that's not telling you what's happening behind the scenes. It might be empty because actually it's a Sunday and everything's being sold. But the reality is that the bakery is absolutely fine. And so free T3 in the context of I guess the patients who are underactive, it can be a bit misleading, can't it? Is that fair to say?
Yeah, I think that's fair to say. I mean, often we can actually just do what we need to really with TSH as a marker, isn't it? All I was thinking was we should probably mention there that sometimes TSH isn't that useful in rare cases, isn't it? But that's
and I think that's a good point, because I think as is the case with so many aspects of medicine, as a general rule, free T3 in underactive patients is not a really big piece of the pie, but there are some rare scenarios where it can be a useful piece of
but what I was sort of saying there is that TSH, sometimes a GP just refers in having just done a TSH level, and almost 95% of the time that's fine, isn't it? But sometimes we need some extra information.
Yeah, that's quite so.
In secondary thyroid problems, that's what I was just thinking about.
Right, yeah. And so basically T3 really handy if you're overactive, not quite so handy if you're underactive. I suppose my sort of parting shot with that is to say that so often when you're poorly, your free T3 levels will be low. Again, your thyroid is fine. It's just that the thyroid hormone levels change as a consequence of the illness, and it's not the underlying cause. I know we get
a lot of phone calls about that, don't we?
Yeah, lots of phone calls about people who've got a low free T3, which is a feature of their illness, and when their illness gets better, the free T3 comes up again.